holiday here. So we have been screening patients with eye conditions and those ones with disabilities. And on basically me, I'm working on the side of the eyes, and we have so far screened patients approximately 300 plus. And still we hope more to come, and they are turning up in large numbers, and we have really seen that there is really need high services in this community because the burden of blindness is on increase, and those ones with diabetic conditions, and then those ones with cataracts, and those ones with allergies, and so on. So far we have also those ones who have been coming with disabilities, and then those ones with mental disorders, they have also been helped, and they are issuing the drugs to them. And also my friends who also, I think, they also have their numbers which they have been seeing, but they have been coming up also. So, well, we have those ones which we call congenital conditions, which children are born with, and especially like cataracts. And those ones are maternal issues. Maybe some mothers don't attend the antenatal, and then causes those kind of eye conditions like cataracts. Then in adults, most of them, some of them are age related when they come, especially from age of 50 and above. They are also prone to develop some conditions like comas. They also manifest in that at that age bracket. And also patients with high blood pressure and then diabetes is one of the leading causes of eye condition, blindness, or visual impairment in the community, which also needs to be looked at. And actually we advise them that everyone from the age of 40 and above need to have eye checkup, because it is so significant that these days diabetes is doing a lot of damage to people's eyes. And also these cataracts, most of them are in adults. That one is age related, can be inheritance in families, and also can be also due to diabetes and also high blood pressure. So most of them they come in such a way, and we really need eye services in the community, because most of our patients don't visit hospitals. They just sit in the villages, and they just, some of them, they claim it is witchcraft which has caused that, and some of them fear that when you go to the hospital, they will remove your eye and then replace with that one of an animal or whatever, which is not true. So that fear makes some of them to sit back, and then they don't access these services. But now when we come like this, some of them, they bring them, they can convince them and come, and also have services and also find out what their problem is. So it is really very, very important, and we appreciate our funders who have endeavored to offer these services to the community, to reach out to those people who are far in villages and hard to reach areas where some people have been neglected, and especially the old people. They say that this one is old, so it is the old age which has caused that, so it is normal to go blind when you grow old, which is not also good. So we really appreciate so much that these services continue, that we can find out these abnormalities, and then see how we can help people to reduce the burden of blindness in the community.
This activity is sponsored by Benedictine Eye Hospital and partners. We have been in Bali for so far 3 days in the district local government. That is J1 Health Center 3, Busiu sub-county, and also Health Center 4. We have reached out to 5 types of patients. Those are patients who have eye conditions or patients with ophthalmology conditions, persons with albinism, also children with disability, physical disability, and others with physical disability, then mental health conditions, ENT conditions, and also other illnesses which are affiliated to that. Over the last 3 days, we have reached out to more than 500 clients across the 3 outreach sites, thanks to our partners, including the district local government, Bali district local government, who have supported us all the way in terms of mobilization, sensitization, and also offering logistical and personal support. This project has really come in very helpful to the communities and to the district, because it is tackling the conditions that have for a long time been neglected or that have not been offered adequate attention. For instance, the persons with albinism receiving sunscreens and also receiving some eye screening and also eye management, ENT cases, and also physical disability, among the others. We believe such interventions need to be applied on a frequent basis to help especially the most vulnerable poor people in our communities. It is on this note that I believe, going forward, it is very important that we all partner, us as Benedictine Hospital and any other partner who is willing to partner with us, to come in and help these people in the communities who are many, but they lack places where to come and get this done. Benedictine in the region has been a leading institution, being that it is a PNF, private not-for-profit organization, in terms of offering aid to the most vulnerable people in our communities. And on this note, even starting from next week, it is moved from the district local government of Bali to the city. In the city, the institution plans to have 4 days of activities in primary schools. That is Tuesday, Wednesday, Thursday, and Friday, where we are trying to reach out to the most vulnerable children. We want them, the few who might not have reached out in the community because they were in school. We pray and hope that these activities are really made part and parcel of our programs, not only in our district government, and not only in our city, but also in the surrounding programs. We also want to request and thank Nandala Foundation for its continuous efforts to offer services to the most vulnerable people in Busiu and the surrounding area, and not only Sironko, but also in the surrounding areas of Busiu and also their neighbors. And we pray that there is continuity in these services. For next week's activity, because we are concluding the community outreach in the district local government this day today, we shall be targeting children also under the same spectrum, but primary school children, with also ear, nose and throat problems, with the children with albinism. We shall also be targeting children with physical disability, children who have mental health conditions, and also other affiliated conditions. Whereby, also on that note, I would like to thank the Bali City Council for granting us the permission and the opportunity and partnering with us as Benedictine Eye Hospital to help us achieve our goal of helping the most vulnerable children in our communities who might not be able to afford these services in the hospitals, but we really desire to have them. We hope that as our institution is a Catholic founded hospital founded by the Benedictine Fathers, we hope that going forward and we can be able to achieve a lot, because it is through giving, that you find meaning in life. And we request anybody who can reach out, just like we've partnered with other institutions in the past, and other organizations and other foundations, to be able to help our people in the community. Thank you so much.
Yeah, my name is Dr. Nyoro Susan. I'm a medical officer in the Busiu Health Center 4, as well as the assistant in charge. And today I'm privileged to host a team of people led by the St. Benedictine Hospital, that is the eye hospital in Tororo. We are having a medical camp, which is really a privilege for our community. And in this camp, we are screening for eye conditions, we are screening for ENT, we are screening and managing sickle cell patients, people with disabilities, and any other conditions. Like, in a camp, you don't limit people. It has been a very good mobilization because people came in large numbers. So far, it is just half a day, but we have seen around 500 people, and it has really been of good help in a way that people have had illnesses for some good time, but they've come today because of the camp. Actually, I was even asking some people that, but you've been sick, why didn't you come? But they came because of the camp. People have had conditions, for example, a girl of 16 years, since 4 years, she got some illness and she stopped hearing, stopped talking. But they've been home, they've never come. Yet this is someone who would benefit from examination of the ear, and they can even give her hearing aids and she hears, but she did not turn up. We have seen cases where they've suffered injuries because of accidents, but they've come today because of the camp. So it's with great impact, especially to us as we see the Center 4, but also to the community. So I would like to extend my appreciation to all the partners involved in this camp. I have seen even medicines which we don't afford here, but people are able to receive all those medicines because of this camp. My recommendation is, because of this camp, I've noticed that we have a very big problem, especially concerning an eye. Many people have eye problems, but they've not had help. They've not known where to go. Mental illnesses. I've seen people here with mental illnesses, but they were just seated there home in the village. They didn't know what to do. But right now they've come and they're being helped, and I believe it's going to improve their well-being. So I would recommend to the partners to kindly help to make these camps regular. I imagine if these camps were regular, we would even have bigger numbers to even help us also in our system, our data system, but also it helps us to know and plan and know where the problem is. So when we are doing our outreach programs as a mandate of the health sub-district, we can also know that this is a big problem somewhere, and we can also continue following up and doing some outreaches in those areas. Then also, if this service can be extended elsewhere. For example, maybe we can put them in facilities, but we can also put these in the communities. Maybe we identify a community where we see, maybe for example now the eyes. We see, most of these people are coming from, because I've noted most patients are coming from Atorotoro. We can decide to say, let's extend the camp nearer there and put the camp there. This will help our people to, one, promote health and well-being, because when you're screening, you're preventing disease, but also to give hope, restore hope to people who have lost hope. Someone is there, they have a problem, it can be managed, but they're not coming. But because of the camp, the announcements made, the mobilization, they're able to come and improve their quality of life. Thank you so much. We're still seeing patients, and yeah. So I think what I could recommend is, we need regular screening services, both in the government and private facilities. What I'm trying to mean is, people usually wait when they are sick, when they come. But if we had screening programs where even if I'm not sick, I go somewhere and I'm screened, if we get partners to help in extending these screenings, for example, like the Benedictine Hospital, if it would organize different screenings in different places, for example in schools and different workplaces. We have people in the banks, they have eye problems. but they have no time to go to health facility. But if we did screenings regularly, we would reduce this. Then also empowerment, or I can say supplies, making supplies to be available, like eye medications. In Busiu, we receive very few, and usually they run out of stock. And since we don't even have a ophthalmology person or specialist, we refer most cases to Mbali. So some of them, when you refer them, they go back home because they don't have transport, or even there are no medicines. So maybe in partnership, we get maybe supplies, then we have regular program screening, even training of staff for capacity building in some of these conditions, like mental health, eye conditions, and so on. I think to reduce such overwhelming numbers, because people would have been managed. Or if we made the camps regularly, maybe like every quarter. First we do your things quarterly. We say every quarter there is a camp. That is every 3 months. It can reduce these overwhelming numbers.
Okay.